My name is Fred Legg. I'm an occupational therapist, and I've been basically working in assisted living facilities. That's working with the geriatric population. I'm actually an area manager, working with various occupational therapists, physical therapists, and speech pathologists. And I've been a therapist now for 30 years.
How did you first hear about ETPS therapy?
We got a flyer in the mail, and basically I know it was the year of chronic pain. We were working with some HMS systems, and we just wanted to know this was another part of the practice, and figured out what if it was going to be good or not for our chronic pain.
And you decided to take the course. Where did you first learn the technique?
First learned the technique in Kissimmee with Bruce.
And how has the therapy been working for you?
It's just like changed my whole world. Every therapist that we've had in all 4 buildings have been sent to ETPS training. So it was just changed our whole pattern of thinking.
What are some things now that you're seeing that you're able to do that you weren't able to do prior to receiving the training?
I think one thing was basically people had a lot of chronic pain, and we were treating them with NDT and PNF, HEAT and E-stem, and range of motion and all this other modalities that we'd use. But unfortunately, a lot of the pain never went away. We wound up treating our patients for 30 days, recycling for maybe another 30 days, and discharging them with pretty much the same pain that they had, if not just maybe gone from 10-10 to maybe 6-10, and then within weeks back again.
Are there any specific patients that stand out in your mind that you've treated where they've received real dramatic responses?
Basically, we've had a couple people. We had one CVA who's a young girl. When I say young girl, I'm 54. She's like 26. She came in with very little movement in her hand, and using the ETPS patterns, on upper body, neck, and shoulder, and also doing a lot of different just stimulation in the hand element. She's now flexing her hand, extending her hand, picking things up, and she has small children, so she's ecstatic. There's been another guy that was drunk, fell out of riding on his bicycle and fell, separated his shoulder. We're doing a lot of neck and shoulder protocol, and definitely see a lot of progress as far as, especially with pain, 10 pain going down to nothing before we discharge them.
Silly question, seeing that you sent, like you said, other people to the course from your group, but would you recommend this therapy to other health professionals?
Oh, definitely. We're a strong advocate. Throughout, no matter who we speak to, whatever shows we are at, whatever, therapy people that come in or vendors, we're always talking about ETPS.
Thanks, Fred.
You're welcome.